Norah Adhiambo in Nairobi, and we welcome our viewers in Kenya and around the world to Checkpoint. This program takes global and exclusive look at evocative issues affecting public attitude in sports, arts and culture, health and education. Let's take a look at the stories making headlines. US military says attack kills 9 Al-Shabaab fighters. The United States military said it killed 9 fighters in an air attack targeting Al-Shabaab fighters in Lebede, Somalia, as part of its operations to support the government's efforts to weaken the armed group. U.S. military involvement in Somalia has grown since President Donald Trump approved expanded operations against Al-Shabaab early in his term. Indian woman arrested for marrying 17-year-old boy. Police in the Indian city of Mumbai have arrested a 20-year-old woman for marrying a 17-year-old boy. The woman and the couple's 5-month-old daughter have been in prison for the past fortnight. She was arrested after the teenager's mother lodged a police complaint. She has been charged under the stringent Child Sex Abuse Act. Chinese patients head to India for latest medicine after domestic crackdown. Hua was infected with hepatitis C by a blood transfusion during surgery. Before the trip, she was already in the middle stage of liver fibrosis, which might eventually lead to cirrhosis and even liver cancer. Then she found out companies that are willing to help Chinese patients like her seek treatment in India at a reasonable cost. Hua was taken to one of India's best liver doctors in a private hospital and prescribed medication not yet available in China. Within 4 weeks, Hua's symptoms had vanished and hepatitis could not be detected during a regular health check. Among the 3 global stories, our main focus will be on Kenyans traveling outside the country for treatment. People in need of medical service in Taita Taveta and Kwale counties are now trooping to Tanzania seeking for treatment after medical services in most public hospitals at the coast remain grounded. The hospitals are not operating due to the ongoing nationwide nurses' strike, which has left most health services paralyzed. Feel free to comment your views on my Twitter handle at Norah Adhiambo. Let me read one of the comments from our viewers at Esimudoni, which says that the government should pay doctors and nurses on time to avoid strike in order to save Kenyans' life. Our correspondent Neema Atieno is joining us live. Neema, if you can hear me well, please explain to us the situation on your side concerning this issue of Kenyan traveling outside for treatment.
Most Kenyans travel outside the country to seek medical attention, and yet we have professional doctors in this country. The major problem is that doctors and nurses have been striking several times because the government is failing to fulfill their promise. They claim that their salary is very low and the government is not doing anything concerning the matter. Other people are saying that they prefer traveling outside the country such as India for treatment because they are sure of getting good medical attention as fast as possible. I think the government should hold several meetings with the health officers to solve the problem.
I prefer being treated abroad because doctors in Kenya, you're two-way. You don't know if they'll be back to work or if you'll be treated and get healed. You may get there are instances whereby they write wrong prescriptions for you. You're being treated for the disease that you don't have. I've had cases of misdiagnosis, me myself, so I prefer going abroad for treatment than staying in Kenya. I will prefer being treated abroad because one, our doctors strike frequently. So being in the hospital for a long time and then they strike, you'll be so cautious because you won't get the attention, you won't get the medication. And also another thing is that better facilities are, as in abroad. We don't have so many facilities that will cater for some of the sicknesses that people have here in Kenya. That's why I really prefer being treated abroad.
Yes, Norah, I can hear you clearly, and I've gotten to speak to some people here and they say that they prefer seeking medical attention outside the country, and this is because recently there have been cases of doctors and nurses going on strike, and it might happen that when they take the loved one to the hospital, they're not sure that they might get treatment. Also, the other reason is that recently there was a case from Nairobi Hospital where doctors did surgery on the wrong patient, and they're not ready to take that risk. And also, in my opinion, I think that It's not really that we don't have good doctors in the country. We have good hospitals like Aga Khan Hospital, Nairobi Hospital that can give us better treatment. But for other people, if they're not sure of getting treatment in the country, they can just go and get it outside the country. Thank you, Nora. Back to you in studio.
Thank you very much, Neema Atieno. There's a viewer who has also commented on Twitter at WalterJoel12. He says that we will not be depending on doctors from other countries, and yet we have good doctors in Kenya. The government should solve the problem. Today I'm joined with a panel of opinion leaders. With me here is Dr. Nicholas Muchui. I'm also joined with Mr. Billy Kadima. Lastly, we have Mr. Morris Kimato, who is a lab technician. Let's start with you, Dr. Nicholas. Can you please tell us how equipped are the hospitals in Kenya, and are you receiving enough facility?
Thank you, Nora. Yes, currently the government have spent a lot, and they have important most of the equipment, modern equipment that are needed for diagnosing and also curing many of the conditions. The reason why most of the Kenyans will find it easier to go there to the outside the country to get services. It's because of the beliefs. They believe that there outside the country there are more skilled people than here, that doctors are more skilled. And again, you will find that even if we have the equipment, most of the time they are not working, they are not in good condition, and also we don't have those specialists that most of them they come from outside the country. Most doctors come from outside the country. So people who have money a lot, the ones who are capable, they find it better to go there outside because of services they get there. They believe that they will get original services, and they don't believe our doctors most of the time. That is the common issue that most of Kenyans ask that makes them go there outside the country to get services. Yeah.
To you, Mr. Billy. Can you please tell us why people are going for treatment outside the country, and please explain how expensive it is?
Thank you, Norah. Kenya have good doctors, but the problem with Kenya, they don't have enough doctors compared to other countries. For example, where I'm coming from in Congo. We have so many doctors, but they are not professional as Kenya. That's why people like going over to countries to go for better treatment. I can say Kenya, they have good doctors, but they don't have enough equipment. And that's why people like going up country, because that side they have equipment, they have so many doctors, and the treatment will be faster and will be professional. That's why I'll ask the government to provide the good equipment, to the doctors in Kenya, so that they can better the service, and yeah, and they'll be okay. They'll be professional as well.
Lastly, let's hear from you, Mr. Morris. Tell us what is causing this problem of a doctor giving medication to a wrong patient, and what do you think can be done to prevent this from happening?
Okay, thank you, Norah. I want to identify like 4 key points why doctors in Kenya give wrong medication to patients. One of the key points is that most of the patients who have language barrier to doctors in Kenya, that is one of the things can lead to wrong medication to the patient. Second thing is a patient may send a relative to a hospital to get some of the medication, which of sure the relative cannot explain specific signs and symptoms that the patient has. We have failure of the doctors to identify a patient by giving a name tag. The inpatients who are admitted to the hospital. you might find that most of them share names, and in that case, a prescription might land to one of different patients, and that gives a patient doctor wrong medication to a patient. So case of in Kenyan, whereby we need to give health education to patients that about the signs and symptoms, whereby a patient enters into a doctor's room can identify specific place where the problem is. This one key point, communication can be attained. We have a patient who talks in sign language. Those are hard to understand to a doctor, whereby this patient should be accompanied by an interpreter, so who can give good information to a doctor. About sending a relative to pick a trunk for a patient who is still bedridden, who is still at home, it's a challenge to some of the doctors, whereby identifying symptom or illness for a patient who has just entered somebody is very hard for that. And that if we rectify those so minor things, as we say, can bring up good and relationship between a patient and the doctor, and giving the right medication to a patient. That will lead patient not seeking medication from outside our country, but having trust to a Kenyan doctor. Thank you.
Thank you all for your time. Let me read for you one last comment from Mwanzia Angela. She says that Kenyans traveling to Tanzania for medication is very embarrassing because we have patients from Tanzania being treated here in Kenya. Lastly, on my point of view, I think we have professional doctors here in Kenya, of which it's not necessary for citizens to spend a lot of money traveling to other countries for medication. The only thing that needs to be done is for the government to provide all the facilities needed in the lab and to pay the doctors their salary well. By doing this, we will not have cases on doctors on going strike. Therefore, patients will not have to travel for treatment. You can continue with the conversation online through my Twitter handle at Norah Adhiambo. I was your host, Norah Adhiambo. Goodbye.